Mishra with SRQ Magazine, and today I'm your host for our In Conversation podcast series. We've invited Dr. Avantika Mishra of Florida Digestive Health Specialists. Dr. Mishra, thank you so much for being here as part of our Perspectives in Medicine series.
Thanks so much for having me.
Absolutely. Could you start by telling us a little bit about the Florida Digestive Health Specialists?
Yes, so we're a large gastroenterology organization serving a huge area in Florida, but there is a large organization and presence here in the Sarasota and Lakewood Ranch area.
What are some of the particular ailments or specialities that are most likely to be seen in practice?
So gastroenterology is very interesting because it's an all-encompassing specialty. We deal with disorders starting from the mouth, swallowing in the esophagus, the stomach, the liver, the gallbladder, the pancreas, the small intestine, and the large intestine. So anything related to digestive health is incorporated in gastroenterology.
So I think one of the things that's always the most interesting to find out is, why was this your calling? What brought you to, and maybe a two-part question, what brought you to being a physician and then this specialty?
Yeah, so I had an interesting kind of trajectory to becoming involved in medicine to begin with. I always knew I wanted to help people, but the way to approach that was very nuanced. I initially started off thinking I wanted to do health policy and work in diplomacy and work on the international level. And ultimately I realized that I wanted, after going on medical missions and really dealing with patients in different countries and different clinics, even locally in the United States as well as abroad, that I felt the way I made the most impact was direct patient contact. And so ultimately that helped steer me into medicine itself. And then GI was my calling ultimately because I think basic happiness comes from enjoying simple pleasures, and I think quality of life has always kind of been the number one thing in terms of why I wanted to be a doctor and why I wanted to help people. And I think having a meal with loved ones, having shared experiences, being able to have good bowel movements, those are basic and simple pleasures that I think really impact people's quality of life and can, really help people.
So I had already gotten my next question ready, but I have to amend it slightly. My next question is there a particular family meal that you remember? Definitely not a particular bowel movement at which you felt this is something.
I know.
I can't believe you did this to me. That this is something special and something, like, is there a particular family meal at which you kind of realized that this was something special?
I think it's not about like a special event or a special meal. It's the day-to-day basics of having a good quality of life. And ultimately, I think through my experiences, not only in health policy, but also meeting patients from many different backgrounds, this is a simple and basic pleasure that many cannot enjoy due to a variety of diseases and ailments that they have. And I realized that how this basic concept, it just really motivated me to want to provide a basic pleasure for patients and do the best to help them.
Is there a particular part of gastroenterology that is your niche, that you're especially focused on?
I perform general gastroenterology, meaning all the organ systems that I previously mentioned. I'm able to treat ailments in those areas, but I'm very interested in cancer prevention, reflux disorders, inflammatory bowel disease, women's health, liver disorders, and additionally many other topics.
How do physicians find their way, or not physicians, how do patients find their way to you? And then what's the experience when they come into the offices?
Ultimately, I think a lot of the patients that we see often present initially to their primary care physician with different concerns and ailments. We see a lot of patients, especially since the new guidelines came out this year, who are looking for colon cancer screening. Originally, the previous guidelines used to say that at 50 years old, you should get colon cancer screening. But recently, the guidelines have been amended amongst all health societies to say 45. So we get a lot of patients through primary care looking to get screening for colon cancer through colonoscopy. And then additionally, just any of the above complaints, people who are having disorders with swallowing, patients who have abdominal pain, patients that are having issues with defecation or bowel movements, people who are bleeding. I mean, we see all range of digestive disorders. So it's very all-encompassing, which makes the field very interesting. But yeah, typically either through primary care or patients who are just seeking care for these specific ailments that they have.
When they come in, often is it a mystery initially? They come in with particular symptoms, and then you have to figure out where in this run of organs the problem is.
Yeah, I think ultimately a lot of people come in with abdominal pain as a very common symptom, and so it's very common to come in thinking that you have a disorder in one area. But there are many organ systems that we're considering when we're trying to diagnose symptoms. And so it's a very nuanced field in the sense of there are lots of ways to clinically diagnose problems and symptoms. And so it's very complicated, but ultimately, it's the questions that we ask and the physical examination that we perform. Those are things that help guide us to treating people.
How do you interact with a patient who comes in and they feel like they've tried it all and nothing has helped, or they're starting to feel a little hopeless because the process maybe has been long up to this point?
We see this all the time, more often than I would like, but I often think you have to get down to fundamentals, and most of the time it's that patients don't feel seen or heard. And if you really dissect their experience, you'll notice that the fundamental problem is really stemming from the original time of diagnosis or the original time of symptoms. And unfortunately, the trajectory sometimes misses the mark. But I think ultimately, if you really sit down with patients and try to get down to the root symptoms originally, that you can actually provide a lot of benefit for them. I also think there's a huge component of patient-physician relationship that is very crucial in this interaction as well. And so I think if you ultimately spend few minutes just to take a break and listen to the patient rather than interjecting your own beliefs, I think that goes a huge way with helping diagnose someone who's tried it all, but really maybe just hasn't been heard.
Yeah. I wanted to go back to something that you had brought up, which was interesting. I certainly hadn't heard about the new age for colon cancer scannings. Do you know some about the science behind that and what the drivers are and what they're finding or what you're finding?
Yeah, so I think overall, there have been large population studies done that help drive these screening guideline changes. And this happens in every field, whether it's in breast cancer screening or other disorders. But ultimately, there's just been a rising incidence of colorectal cancer in patients at a younger age. And the median age was previously 50, which is why that was that recommendation. But, these days, I'm seeing colon cancer personally myself, younger and younger. And, I've diagnosed it as young as someone in their early 30s most recently. And so ultimately, while we don't perform screening on everyone who has symptoms, these generalized studies for the population have really triggered, all societies to amend their previous recommendations.
And what you just said is that we're finding it earlier, not that we're doing a better job looking for it, but that it's occurring earlier. Did I understand that right?
So I think, yes, I think what was previously perhaps happening, and again, this is a little bit of a generalization, is I think we have national guidelines where there's routine screenings that are often facilitated by primary care offices for a patient, and we were performing those screenings at that time, but we were diagnosing colorectal cancer earlier. And so then there was a whole section of patients or age group of patients, like a whole demographic that was being missed or delayed diagnosis because they didn't fall under this umbrella for early screening. And so because of the earlier diagnoses that were being made, now instead of being a reactive reactive testing. Now we're doing preventative testing. So that's how the strategy has been changed.
Whether it's colon cancer or celiac, if that fits into the same practice, or IBS or colitis, are these are the incidence of this in our population increasing in response to lifestyle choices? Is that the path we're on, or?
Yeah, so I think ultimately we're just becoming a lot more knowledgeable about certain diagnoses just because science has improved and diagnostic testing has improved, awareness has improved. And I do feel if you look at population studies, not just in the United States, but across the whole world, that the incidence of these diseases is increasing not only because of what I just mentioned, but because of environment and lifestyle. Genetics always has a huge has a role in disease development, but I think there has been a huge shift in lifestyle, environmental exposures that are kind of precipitating more diseases precipitating diseases to develop. Yeah.
What is your advice to people to keep their digestive system healthy and well? Not your interventional, but your preventative.
Yeah. I think the fundamentals still hold very true. And this holds for many different specialties. I think ultimately hydration is key for prevention. So if you're drinking your 64 ounces of water per day, drink up. Plant-based diet, which is very crucial to your digestive health, but also your cardiac health, amongst other organ system healths. That's very important. And then for digestive disease prevention, high fiber diet is very crucial, especially for things like colon cancer prevention. So these are very basic things that we can do in our own life that, can promote our own health.
Wonderful. It is always hard to abide by the eating policies and the drinking policies that are best for ourselves. How well do you do?
I do my best. I'm only human as well, and I also enjoy the occasional pleasure, whether it's a glass of wine or, the occasional, high sugar dessert. But, ultimately, I think for me personally, you have to practice what you preach, and we just do our best, but understand where others are coming from.
Just switch gears a little bit. As a woman in the medical industry, as a female doctor, are there particular experiences that either challenges or positive mentor experiences that you've had that are because of your gender?
That's a very interesting question. I think in the field of gastroenterology, particularly when I was in training, there was a little bit of a lack of mentorship because at that point, less than 10% of gastroenterologists were females. So in the past several years, there's been a lot of momentum, and actually medicine is changing in the sense that there's a lot more females entering medical school than males at this point. So the tides are changing a little bit. And I think people who are out in practice now, whether in academics or private practice, especially in the field of GI, we acknowledge that dramatic mentorship is needed. So I myself have taken on roles of mentorship to help people behind me because that was something that I didn't receive. And so I've had to pave my way a little bit. But now I'm trying to pay it back because I think ultimately that would have made my experience rising in this field a lot more positive.
As a female doctor, are there patients that come to you preferring perhaps the perspective you might have on your own biological system that gives them a sense that you understand where they are with a challenge they might have?
I think it definitely helps having a female perspective, ultimately because of my own independent experience. But I think empathy goes a huge way because you have a personal understanding. And so, yes, I see a lot of female patients with ailments that are not quite diagnosed. And I think ultimately being able to relate and also acknowledge that there are some perplexing diseases and disorders that are very particular to the female body versus the male body, I think it helps. And I think, again, it goes back to patients wanting to feel seen and heard.
Sounds wonderful. Well, I think that covers everything I wanted to ask. I definitely could continue talking with you as long as we had, but we are running out of time. Dr. Mishra, thank you so much for being here. You are welcome back anytime to continue the conversation, and next time we'll dig even deeper into some of these categories.
Thank you. I look forward to
Really
it.
a pleasure. Thank you. This was a conversation for SRQ Magazine in Conversation series. My thanks to Dr. Mishra for being here with me today, and thank you all for joining us. I look forward to being here to talk with our next physician, and you all can join us. Thank you.